Next, we have chemical peels. Chemical peels come in a variety of different formulations that can specifically target your concern. If it's pigmentation, sun damage, mild acne scars, enlarged pores, or just a general overall freshening of the skin, a chemical peel can be the very thing that would be appropriate for your skin type. Peels are done and put directly on the skin topically for a number of minutes. The number of minutes that it remains on the skin depends on the response of your skin. We're looking for a pink response in the skin, and also patient comfort is taken into consideration. So let's apply a layer of a chemical peel. Chemical peels come, as I said, in a variety of different formulations. Generally speaking, you will find alpha hydroxy acids, and we're all familiar with that, with glycolic acid, which is a common ingredient in many skin products, from acne treatments to anti-aging. Beta hydroxy acids are also used. They are derived from salicylic acid, which is another common ingredient we find in over-the-counter acne products. Today, we are going to use a 10% solution. The skin has been cleansed, and we are taking a gauze and we are going to apply this over the surface of the skin with mild or little or no pressure and an even distribution. Our timer is set and we're processing the chemical peel. What we're looking for as we process the peel is a little bit of a change in the skin color, whether it be maybe a mild pinkness or sometimes actual frosting, like a shimmery film appears on the skin, and that's telling us that the chemical peel is penetrating into the skin. Also, we ask our patient for a level read of this, 1 being a drop of water, 10 being you got a sunburn. And where would you put the tingling level in your skin?
3.
A 3. All over or just in spots?
Just in spots.
Just in certain areas. People ask me quite often, am I going to peel, or I don't want my friends to know what I'm doing, and I'm concerned about recovery time with a chemical peel. Our peels are blended peels so that they are focusing away from recovery time. No one will really know what you're doing. In some instances, you may get a mild little exfoliation, kind of like cake crumbs on the face. Nothing that would keep you from going to work or keeping up with your regular lifestyle. It just might make your makeup a little tricky for a day or two, but that's about it. And so we're watching that skin. We're seeing a little bit of a pinkness in the skin, but not an extreme response to this, which is just fine. Many people think that the peel has to burn or it's going to exfoliate like a snake, and that is not true. Deeper peels of more intensity for certain skin concerns may do that. The peels we use in our aesthetic room here at Muscatine Dermatology are geared to fit in with your lifestyle so that there's no recovery time and you can make progress without anyone knowing that you're doing it. The peel has been processed and we're neutralizing. People enjoy chemical peels because they're quick, they're fast, they're pain-free, and they get results. After we have removed any residue of the peel, we're going to put some serums on the skin. Again, I'm going to choose the peptide serum, which is one of our clients' favorites because it has a nice way of firming and tightening the skin, targeting enlarged pores, and helping to smooth and refine the skin. Serums are wonderful because they do so many great things and they don't feel heavy or occlusive on the skin. A good rule of thumb to remember if you're confused as to what comes first, the liquid, the lotion, the cream, the weight of the product designates the place of its application. So a gel would come before a serum would come before a lotion, and a lotion would come before a cream. Just remember, the heavier the density, the further out it goes into the application. We've applied our serum, And now we are going to apply a sunscreen over the entire face, which is always the frosting on the cake and the most important factor. I'm going to apply some goggles so I don't mess up her makeup, and then use one of our latest products, which is Replenix SPF with a 50 plus. We shake the product, and spritz it on the skin. This is very popular with patients who don't like a heavy weight in their sunscreen, or they want to apply their sunscreen periodically through the day without messing up their makeup. So our sunscreen is applied. We're going to gently rock this into the skin. This is another important thing to remember too. If you have sensitive, intolerant skin type and your skin responds adversely to sunscreen, we're not rubbing it into the skin because it's not necessarily a moisturizer to hydrate the skin. It's there to act as a protective shield on the skin, and therefore placement on that is gentle, and we do a gentle rocking of the SPF onto the skin surface until it disappears. For protection, good rule of thumb to remember, when you put down your toothbrush, pick up your SPF, because wearing your SPF daily is obviously the best defense against skin cancer, but most important as well, fighting that anti-aging that we're all after.